one of the things I'll just comment very quickly as we adapt to this this setup, that the last 2 years have taught me that you are just going to have to be adaptable to things. So please bear with me, as there's lots up here today. So thank you, commissioners, for the opportunity to provide this update to you. I did want to just start off and say, since the last time I presented to you at the beginning of January, we've experienced a very large increase in cases. We had added about 12,700 new cases to our total in the last month. That's about 410 cases per day and almost 3,000 cases per week on average. In 1 week, for example, alone, we added almost 4,000 new cases. With the recent surge, Buncombe County has now reached a total over 46,000 total cases of COVID-19 identified since March of 2020. You can see here, I've started off with our epi curve. This visual shows our COVID story in peaks and valleys. It is clear as you look toward the far part of the curve that the Omicron surge has been rapid in its climb and intense in its burden of cases. However, I do have some good news to share with you today as far as recent trends. As you can see at the far end, and if you focus in just a little bit, we are starting to see a decline in new cases. Last week, we were experiencing 907 new cases per 100,000 per week, which was a significant decrease and somewhat impacted by the winter weather and holiday that we had, because throughout that week we saw it rebound a little bit and go up to the mid-900s. But as of yesterday, when we did the week-to-week analysis, we see that as of yesterday, our case rate decreased to 875 new cases per 100,000. And this rate continues to decrease today when I looked at the dashboard before I came in to the meeting. So this is good news. While there is still considerable spread and we are still clearly in a community with high transmission, cases are anticipated to decline quickly. Additionally, the percent positivity has declined for the first time since mid-December. For the last week or so, we have been experiencing a percent positivity of well over 25%, and most of the time in the mid 25%. This week, we find the percent positivity around 24%. While the case rate and the percent positivity are showing signs of decline and signs of hope that the surge may be dissipating, hospitalizations and deaths are not yet showing that same decline. This is not altogether surprising. You've heard me say before that our COVID-like illness is our first indicator, followed by our case rates, and then our hospitalizations and our deaths tend to be lagging of those case rates. So here, what you're seeing is the Western North Carolina regional hospital data that is showing a continued increase in inpatient beds occupied with COVID-19 and a steady increase in ICU utilization. Specifically for our Mission Hospital system, we have recently seen high stabilization in the inpatient beds with COVID-19. Over the last several days, there have been anywhere from 181 to 188 COVID-19 positive inpatients across the Mission Health system. So not just Mission Hospital located here in Asheville, but across the system. And just a reminder that across the state, about 70% of hospitalizations are in those who are unvaccinated, with only 5% of those hospitalizations in folks who are vaccinated and boosted. And about 79% of ICU utilization across the state is in the unvaccinated. Additionally, 13 new deaths have been reported to the dashboard, bringing our death rate from 4.2 deaths per 100,000 per week last week to about 5 deaths per week per 100,000 per week this week. We now have lost 488 neighbors to COVID-19 related deaths. Again, as cases continue to decrease, it is likely that the hospitalizations and death may also begin to see a decrease in the next several days to weeks. And so what I have for you now is our metrics that we've been following since October of 2020. And just to summarize the metrics, while cases and percent positivity remain high, they are beginning to show signs of decline. So this is encouraging. Hospitalizations and deaths are seeing increases right now. We hope to see those indicators. Also, we'll experience a decline as cases further decrease and we find ourselves further down the curve of this surge. I am going to switch gears and talk about recent testing efforts to bridge the need for testing while cases are high and testing demand was high. Over the last few weeks, public health and emergency management have been working to obtain and allocate at-home, rapid at-home test kits and masks to the community. The purpose of this initiative was to create a temporary bridge for the community to access at-home testing while we were experiencing high testing demand, strain on testing providers, and while we work to increase testing opportunities in the county. We created a parallel path of distribution for the at-home test kits that provides a dedicated arm of the initiative to equity and another arm of the initiative for general population. The equity focus path identifies community organizations who serve populations in one or more of the three equity domains, being historically marginalized, low income, and or rural communities. Each community organization then received an allocation based on the population they serve, including high risk of exposure or high risk of severe illness, geographical location, et cetera. Community organizations then were provided agreement, just like what you'll hear on the general population side, picked up their allocations and have begun to distribute to their clients, to their population, through events that they support, like food markets, community centers, homeless outreach, homebound, and other mechanisms. As a result, 34 unique organizations were allocated about 5,100 test kits and 15,000 masks. These included rural community centers, homeless service providers, churches, community health workers, Latinx outreach, and many more. The second arm of the initiative is focused on providing opportunity to the general public to the at-home testing resource. This involved identifying partners that could function as fixed sites throughout the county for distribution. And in order to best serve the general population, we identified fire departments, libraries, and the health department. Using this approach allowed us to have geographical distribution throughout the county, north and south, east and west, and central. We ended up having 18 total locations, 14 fire departments, 3 libraries, and then the health department. The fixed sites have distributed over 6,600 test kits and 12,000 masks. So I just wanted to take a moment to personally thank all the community partners, all the community organizations, the fire departments, the libraries, and the 40 Cox staff for their participation, assistance, and support in getting this resource out to the community. Just to spotlight some of that great work, in particular, Broad River Fire Department actually utilized some of their at-home test kits for the homebound in their community and delivered those to the doors of those individuals. The Asheville Fire Department partnered with Shiloh and Stevens Lee Community Center to provide distribution at those centers' location for ease of access and better reach into the community. And a couple of our rural community centers are utilizing their kits for food security programs that they operate to support those community members. So again, many thanks to the multitude of partners and emergency management, especially Brittany Robinson, who tireless efforts to help support our public health response. While implementing the at-home test kit initiative, we have been working to increase the testing capacity and opportunity in the community, especially while the demand has been so high. Our community added Optum testing provider, a North Carolina Department of Health and Human Service testing resource, to the testing provider list. Optum began providing testing services at UNCA campus on January 21st. And they provide testing from 1 to 8 p.m. on Fridays and then 9 to 5 on Saturday and Sundays. And we anticipate that Optum will be in the community until at least February 20th. The existing North Carolina Department of Health and Human Services testing provider StarMed is also expanding their footprint in the near future. Currently, they are providing services at Harrah's Convention Center, but are planning to migrate their services to a larger space at the Asheville Mall in the coming weeks. Once migration is complete, StarMed will continue to provide services at Harrah's for large events. In addition, StarMed is looking at also adding another day to their AB Tech pop-up testing events, and that will be coming in the coming weeks. So we continue to have a multitude of testing providers listed on the North Carolina Department of Health and Human Services Find My Testing location website. And there are now an increasing number of at-home test kit opportunities, including the recently launched federal program where each home can receive 4 tests by mail. So folks can visit covidtest.gov. And I can say it's pretty simple. Of a process of entering your name and your address. No other information is needed. And just a reminder that folks who are registering for these test kits, that if you live in a multi-unit housing like an apartment, make sure that you do put your apartment number or your unit number. That's really important. And I want to also just say to our community organizations, churches, and others that for folks who may not have internet access or don't find technology easy to use, that please think about helping folks sign up to get these tests. There is also a phone number or so a phone option if folks do not want to use the website. Additionally, individuals can receive an at-home test collection kit, so not a rapid test, but a test collection kit that you would swab, and then you send that off and get results usually in 24 or so hours after shipment. You can receive those from the North Carolina Department of Health and Human Services by visiting either their North Carolina Department of Health and Human Services Find My Testing location website or visiting ondemand.labcorp.com/NC. And lastly, I just wanted to mention that more and more local pharmacies are replenishing their stock of at-home rapid tests. Just this weekend, I stopped into a few pharmacies just to see what did inventory look like, and there are several that have tables and shelves totally stocked. So, please think about some of the other opportunities that you also have for at-home rapid testing, and recently added that at-home test kit purchase, the over-the-counter at-home rapid test purchase can be covered by insurance, with the exception of some Medicare plans. So please check with your insurance plan provider and the pharmacist that may be covered by your insurance plan or reimbursable. And now I just would like to spend a little time on vaccine efforts. That we did see a slowing in the uptake of vaccine with the holidays and winter break that coincided with schools being out. But I did want to share that right now 72% of our eligible population has received at least one dose, and 69% of our eligible population has received their full primary series. So just a reminder that we're very close to reaching that 70% stretch goal that we all had talked about many, many months ago when vaccine administration first began. Over 94,000 individuals have received their third or booster dose, which is about 55% of that full primary series population. So with the holidays behind us and we still have high transmission, now is a good time for folks to start their series or get their missing dose. And folks can visit us at a community vaccination event that we have planned for Saturday at T.C. Robertson High School. That's February 5th at 10. And you can get your booster dose, you can get your first dose, you can get whatever dose you need at that event. Additionally, we continue to hold our vaccination clinic at 40 Cox. We have seen that demand at the 40 Cox mass vaccination clinic has decreased over time, and anticipate that by the end of February, we will be able to transition that COVID-19 vaccine clinic into our regular immunization operations at the health department. I'll have more to come on that information as we get closer to that transition. And then lastly, just some key points and takeaways for folks at home around that, yes, cases are beginning to decline. It's still important to protect ourselves. If you have symptoms, please stay at home. Call your provider, seek testing at one of the testing providers. Make sure you stay at home for at least 5 days if you're symptomatic or your test is positive, and until your symptoms are getting better and you have no fever. Please remember that vaccines are working to prevent severe illness and hospitalizations and death, and consider getting the dose that you might be missing today and come visit us on Saturday if you need a vaccine. That's all I have for you today. Commissioners, happy to answer any questions.
Stacy, thank you, and that's really awesome to hear about the testing sites and mass distribution. That's fantastic work. I'm sure the community appreciated that. I had a question about vaccination data. Again, just to confirm my own understanding of where that data is coming from. I think you showed 72% of our county with 1 dose. As far as I can tell, the State Department of Health and Human Services has stopped showing that data on their tracker and is using the CDC data. I guess just help me understand where you get that number from so I can...
Thanks for the question. North Carolina Department of Health and Human Services still pulls from their CVMS database. So that's the COVID vaccine management system that North Carolina created for vaccine providers in North Carolina who are not participating in a federal program. And what they do is they combine the CVMS data from North Carolina providers with the CDC data that is gathered and obtained from federal providers, whether it's, typically that's going to be your Department of Justice, your Prison Bureau, your Veterans Affairs. You might remember a few months ago there was some issue with that data around the county of administration versus the county of residence. To my understanding, that has been corrected now, and that data still comes from the CDC. Tiberius is their database to the North Carolina, and all of that is combined. And then you have the federal pharmacy program where our large-scale pharmacies of Walgreens and CVS were participating and still do, and that data is also put in there.
Okay, thank you.
Hey, Stacy, were you able to check on the long-term and congregate living facilities and ensure that they were getting access to boosters? I had reached out to you via email, and I know that there was this one specific one, but I wondered if you were able to check with others and ensure.
Yes, so I can tell you that what I was able to find is that, yes, we still service the really small adult care homes and those groups through our fixed site, making sure that, our mobile outreach. The larger long-term care facilities in the beginning were serviced by large-scale retail pharmacies. The state has since put in some resources for them to be able to get their boosters and whatever doses are missing. And so we've communicated with the long-term care facilities again, make sure that they know that resource is out there and available to them. So, yeah.
Hey, Stacy. Thanks for the presentation. I had a question, maybe if you could comment on. So the the development of the new antiviral pills from Merck and Pfizer are considered to be like a real, hugely important future tool going forward for folks who do contract COVID. The research I've read indicates that if people begin the treatment process early after developing symptoms, they could reduce hospitalizations for people who contract COVID by maybe 90% or so. At least the Pfizer version is that effective. They're still in sort of limited supplies now, but that's expected to be alleviated in the coming weeks and months. Kind of like we're sort of like in the early days of vaccines, right? It's like more demand than supply, but that will change probably pretty soon. There is kind of a somewhat complex process for people to get them, right? And the key is that people need to start taking them quickly after developing symptoms. So, I'm reading that there is some concern about whether as the supplies become more readily available, whether a lot of folks who would really, really benefit from them may end up not successfully getting them in the small window of opportunity that they need to get them by to start taking them to avoid being hospitalized later. So I just wanted to ask, I know that the county is not a direct healthcare provider, but are there any things that we could do to potentially support, a system within the community to make sure that the people who would really benefit from them, which certainly includes people who did not get vaccinated, the elderly, people with other underlying health conditions that make them particularly vulnerable if they do contract COVID, so that they can get tested, get a prescription, and then actually obtain the medications within that matter of just a few days they have, which for folks who are working and are juggling a lot of stuff may be hard. I know some places, like there was media coverage this week around how in New York, people can kind of get qualified, get a prescription over telemedicine, and then they actually deliver the anti-COVID pills directly to your home, and all that happens in the same day. So probably pretty idealized system. They may be in a better position to do that kind of stuff since they're in that direct healthcare providing role, but just as an example of like a neat model to kind of speed things up. But any initial thoughts at this stage for how that's going to work in our community?
Thanks for the question. You're right. For Buncombe County Public Health, we are not a primary care provider, so the direct provision of that type of medical care would be out of our scope. But the concept of facilitating that in some way, or helping get that word out, is something that we could probably assist with. And what comes to mind initially is the safety net provider group that the health department already convenes. And we actually just met with this group, and many of those providers are providers who are listed on the North Carolina Department of Health and Human Services Find Treatment website as having either monoclonal antibody or antiviral therapies available. So I think I could probably take that back to the safety net provider group and sort of see what is possible around a concerted effort, at least around messaging and getting the word out to very vulnerable populations at the very least, to help them understand how to navigate that system. I will say that yes, right now the supply is fairly limited, although it is growing daily, and we do anticipate that at least by March we'll start to see that increase more, and possibly more providers coming on board for that as well.
And so people, to get the antiviral medications, they need to get a prescription for them, right? So I don't know the exact statistics, but there's a fairly meaningful percentage of the community that doesn't have a primary health care provider, right? Like I've read statistics, maybe 25 or 30% of people don't really consider themselves to have that. So what's how would those folks access prescription and treatment?
Well, as I said, many of the providers in our community that are safety net providers are also federally qualified health centers or rural health centers, which are primarily poised to serve those who are underinsured or uninsured completely. And so that would be one of the avenues for an individual who has limited access or no primary care or medical home to be able to get assessed and then possibly get a prescription. First and foremost, it's about once you have been diagnosed or once you have a positive test, being able to get tested quickly, get that diagnosis quickly, and then be able to seek treatment and get treatment very quickly.
Okay, well, thank you for that. I guess I would just say that, to me, the development of those medications is probably the second most important, medical development, second only to vaccines, since this whole thing has happened. And so if there's anything the county can do to play a supportive role, logistically or otherwise, so that if we had enough now, right, and they were being accessed by people who could benefit them, these hospitalization numbers that we have right now could theoretically be a tiny fraction of what they are, right? So I just hope that we can create kind of that community system that really makes this really accessible and easy for people to get them who will need them. So anything we can do to be supportive, I'm certainly very supportive of. Commissioners, any other questions for now? All right, thank you so much, Stacy.
Thank you for your time.